Starches no.
Oh.
Use the starches.
Good morning to all. There was some technical problem, that's why it is delayed. Today I am going to discuss about intranatal care. So do you all remember what antenatal care is? The care that is given during pregnancy to a woman who is pregnant. So after that her complete 9 months, then she will go for delivery. The care which is given during delivery is called intranatal care. So your specific learning objectives are you should be able to enumerate. What you have to enumerate about the objectives, aims of good intranatal care. And then there are two important things. A woman may prefer to deliver at home or she may prefer institution. So you should be able to describe both the situations in which she can deliver. The care, which intranatal care, at if she likes to deliver at home, domiciliary care, and if she delivers at institution, it is the institutional care during delivery. And then you should be able to explain what rooming in is. Rooming in is asked. వస్తలేదా వాళ్ళకి వినిపిస్తుందా? Rooming in is it is asked in the viva. So you should know what rooming in is. We will as I will be going along and explaining, then you will also come across what rooming in is. Introduction. Childbirth. It is a physiological process and it's a normal process. Every woman, when she is pregnant, she delivers, and it is the childbirth which is very much common, and it's a physiological process like any other physiological process, which like we will be passing urine, we go to toilet and all those things. They are like normal physiological process. So childbirth is also considered as a normal physiological process. Then please remember that if delivery is conducted by an unskilled person, then it can result in septicemia. Septicemia is sepsis, and the women during delivery can die because of septicemia, because of the septic manipulations by the untrained persons, unskilled persons. So this is very important. Why we would like to you all to know about what good intranatal care is. Then tetanus neonatorum. It is the tetanus which occurs in the newborn child within 7 days, and it is called tetanus neonatorum, and this is because of the using of unsterilized instruments. So effective there is a need for effective intranatal care. That's why we had to learn about intranatal care today. Then planning and preparing for birth. As I told you all in the antenatal care, that preparation of the birth is one of the important thing during pregnancy. So how you like to plan sitting with the pregnant women about her birth? You should be able to identify a skilled birth attendant who is needed for birth, for delivery. So all pregnant women, they should be able to reach a decision regarding the healthcare personnel they want for conducting their delivery. So they will choose it, but she should be a skilled birth attendant. Skilled birth attendant means I'll tell you what skilled birth attendant means. It is someone who is skilled, like multipurpose health worker female, then health visitor, then the medical office staff nurse, then the medical officers. They all are trained in conducting deliveries. Dyes are not included in skilled birth attendants. Please remember that is asked in your viva. So condition of the pregnant women, her financial situation and distance to healthcare facility, all these have to be considered to plan a birth. Then the transport facilities. What are the transport facilities available to that pregnant women if she likes to come for a delivery to the institution, how far it is. Finally, she has to reach to a decision, that is called planning and preparing for birth. Then what is an institutional delivery? Institutional delivery is something, the delivery which takes place at primary health center, or it can be at above the primary health center, in the community health center, or it can be in the district hospital, or it can also be in teaching hospital like our MIMS hospital. MIMS hospital may be having a OBG department wherein we have a labor room, and the pregnant women are encouraged to opt for an institutional delivery. Why we encourage them? We have to explain why delivery at a facility is recommended, and we should emphasize it because complications can develop at any time during delivery and in the postnatal period, and these complications are never predicted. They cannot be predicted. They are not always predictable. If they are not handled by professionals at health facility, they can cost the mother and the baby their life. Means death of the mother can take place, death of the newborn can occur if they are not handled by the professionals at health facility. Who are the professionals? Again, they all are called skilled birth attendants. Okay. Then if a health facility has what a health facility should have? They should have staff, they should have equipment, they should have drugs, supplies, so that they can provide the best care. And they should also have a referral system. I was telling you all about the referral system when I took a class on primary health care. Do you all remember that? What a referral system, how it works? I think you all remember it. There's not much time. So, coming to home delivery, in spite of all efforts, our efforts explaining to the pregnant women about the complications which are unpredictable, everything, but still the pregnant woman decides to go for delivery. She wants to deliver at home. What are you going to do? Then you have to find out that the situations where complications arise and how the home is risky and life-threatening. In spite of telling, if she decides to deliver at home, it is the female health worker who has to visit her at home and see that, find out how risky it is and how potentially life-threatening it is. Then, in addition to that, we should also give those pregnant women who like to deliver at home a DDK. What is DDK? DDK is Disposable Delivery Kit. In that Disposable Delivery Kit, there are many things in that, like one rubber sheet, and then one baby towel, and then to wrap the baby, and to cut the cord there is a blade, and the cord tie, sterile cord tie is there, the thread, etc., etc. This Disposable Delivery Kit, why are we giving in the hand of pregnant women? Anytime she can deliver, and whoever attends her delivery, she will hand over the DDK to that person, and that person will use the things which are there in the DDK, and that will help in preventing the death in that woman and her newborn. That is why Disposable Delivery Kits. Disposable Delivery Kits are also asked in viva. Please remember that. What all I say, you please make note in your long book and read before you go to exam. And then you should also be able to explain the 6 cleans to such women who wants to deliver at home. What are those 6 cleans? One is the surface on which she will lie down to deliver, that should be clean, and the hands of those who are going to conduct delivery. The hands should be washed with soap and water, and then there is a cord in that cord tie, means a thread which is there in the disposable delivery kit, and there is a blade to cut the cord, clean cord cut, and then clean cord tie, and then clean umbilical stump. They should not put anything on the umbilical stump. It should be left. It is left open, means clean. It should. Some of them are used to put, in the olden days they used to put cow dung on that, and all those things. Any antibiotic, nothing is required. And the clean perineum. The perineum should be cleaned. Means she has to use sanitary. This thing. Then we had to counsel them and help them to maintain the 6 cleans during delivery at home. And we should also keep a record. The primary health center doctor has to keep the record of the women who likes to deliver at home and counsel them continuously during the subsequent visits to opt for an institutional delivery. So all these things. So the clean perineum is using the sanitary pads. That is very important. Then skilled birth attendants, they should prepare herself to attend such women at their home during delivery. Whenever a call is given by the pregnant women to this multipurpose health worker or above, they should be ready and prepare themselves to attend the delivery at home. So all the pregnant women, the family members or the ASHA, any one of them can call over the any skilled birth attendant, whether it is A&M, whether it is health visitor, or whether it is above the doctors, to conduct the delivery at home. And the pregnant women should always have the maternal and child card. Why? Because the person who attends the delivery, they will have a record of all those things. How many antenatal checkups she had, how many iron and folic acid tablets she has taken, whether she has taken DT, diphtheria, tetanus vaccine, all those things will be written in the card. So the card should be always available. It should be like a ready reckoner for those who conduct the delivery. Of course, the clean towels I told, and cloth also I have told you all. Then the sanitary pads, of course. In addition to all these things, there are supplies of Oxytocin and tablet, Misoprostol, and cord clamps, surgical knife, blade, pediatric plastic bag, mask, because sometimes the baby will have asphyxia. That time the person who attends the delivery should be able to resuscitate the newborn. For that they need a mask and a pediatric size bag, etc., and the emergency drugs. So all these are available with the skilled birth attendant. And then we should ensure that they all should ensure that the women is comfortable in the warm environment. Keep all the doors and windows closed so that she keep herself warm. And then water and food should be available at her bedside, so that whenever she likes to have, she can have it. And the person who supports her, a family member or whoever it is. Then in addition to that, the pregnant women should also be, she should be like educated about the signs of labor. What labor means, like when she thinks that she is going to deliver a baby, that is she must be educated about the show. What is show? Show is nothing but it is the sticky discharge which is bloody from the vagina just before person sets into labor. So then later the women will start having a painful uterine contractions with increasing duration as it proceeds, and the frequency, intensity also increases with the time, with the passage of time. And then of course transport system I told. For transport, please remember 108. Tell the pregnant women and all the workers about 108, which is freely available, and it is there throughout Telangana state, and I don't know about the whole country, but in Telangana it is there 108. And if there is a delay in reaching the healthcare facility, it can result in a maternal death. So we have to the skilled birth attendant should be very smart when handling the home delivery. Okay, I'm going to take for some more time because I started late. You won't mind, all of you? Okay. Then delivery should be with minimum injury to both infant and mother. And the complications. If the skilled birth attendant anticipates some complications like prolonged labor, then the hemorrhage antepartum, or the women throws fits, and then there is a malpresentation and there is prolapse of labor, immediately she has to refer the women. That is very important. And for the care of the baby, I told about the resuscitation, then cleaning the eyes, care of the cord, etc. Then how to empower skilled birth attendants. Government of India has taken up a policy to empower the skilled birth attendants for undertaking certain life-saving measures. They have given them the power to use isotonic uterotonic drugs for the prevention of postpartum haemorrhage, that is Oxytocin. Did you all learn it in pharmacology? I think you will be learning, or you might have learned. The use of drugs in emergencies, that is very important, and to perform basic procedures like doing an episiotomy, then suturing, etc. in emergency situation. Then primary health center, because our main aim is 85% of the deliveries are normal, they can take place at primary health center. So the skilled birth attendants providing care at sub-centers or in the domiciliary setting, they can refer their pregnant women for delivery to primary health center. And there are also guidelines for how to go about at primary health center. And I told you all about doctor and the LHV. LHV is lady health visitor, who will support the supervision of skilled birth attendants at sub-centers and primary health centers. Usually deliveries don't take place at a sub-center. Sometimes if they are well equipped, some of the sub-centers, they conduct deliveries. Advantages of domiciliary delivery. What are the advantages? The pregnant woman is familiar with her surroundings at home, and her fear is removed. She doesn't have to be panic about delivery in a hospital, wherein nobody is allowed inside and she is just alone in the labor room, and she is very panic, and there are more chances of cross infection in hospital. And she can also, if she delivers at home, she can keep an eye over other siblings, like other children in the family, and it also removes her mental tension. Disadvantages: very less medical and nursing supervision, because only the person who conducts the delivery is there at home, and then she also resumes domestic duties too early, because she is at home immediately after delivery. She starts working and she neglects her diet because she is so much in the work. And so there are not many houses in our country, they are not suitable for normal delivery, because nearly 70% of them live in rural areas, and most of the deliveries take place at home by multipurpose health worker or untrained person, that is DAI. She is not a skilled birth attendant. So domiciliary outreach, it is a major component of intranatal care. And then who is the important person in conducting domiciliary care, providing domiciliary care? It is the multipurpose health worker, female, and who counsels or educates the pregnant women about the danger signals during delivery. And she also recognizes, because she is trained, and she immediately transfers to the that women who has complications, danger signs, then to the nearest PSC or the hospital. So the danger signals. What are the danger signals? The danger signals are the pain becoming slow, and there is no pains after rupture of membranes, and then after 1 hour there is rupture of membranes but no progress, then prolapse of the cord, meconium stain, like all these things you will learn in your OBG, obstetrics, and excessive show, etc. And the pregnant women may collapse during delivery, during labor. These are all danger signals. And the placenta is not separating even after half an hour after delivery. Then there may be an hemorrhage or collapse, postpartum hemorrhage, or she can just collapse, and the temperature may go up. All these are signs of septicemia or other complications during delivery. It's very important. So institutional care, I told you all that only 1% of the deliveries are abnormal, 4% are difficult, all others are like normal. So, and if an institutional delivery takes place, she will be at like she'll feel comfortable. She doesn't have to resume domestic work immediately after delivery, and she is allowed to take rest for 24 hours after delivery, and then only she gets up and moves about. Summary: childbirth, it is a physiological process. Septicemia, tetanus neonatorum may result from unskilled and septic manipulations. Emphasis is on cleanliness. All 6 cleans. One is hands, clean surface, clean blade, clean cord, clean tie, and clean perineum, that is using sanitary pads. Then the domiciliary care for the mother with normal obstetric history. The institutional care for abnormal and difficult cases. Any questions, please? Is it clear to all of you? Okay, thank you all very much.